This is my rotation reflection for my security and family medicine rotation. The security department of Ellis Medicine is located at Ellis Medicine's primary campus at Knott Street in Schenectady, New York. It's mainly composed of security guards. Their main job is to keep the hospital safe, and they use surveillance to look over all the departments. They do rounds just to make sure everything's going okay, and if a code is called, they will go to the code to make sure everything is okay. They interact with almost the whole hospital to ensure the safety of the patients and the staff of the entire hospital. For the first hour and a half, I was at my security rotation. I was in the ER. I was printing visitor stickers for people. I also got to witness people checking into the ER. I saw a cardiac arrest patient who came in through ambulance, and they were doing CPR on him. I also saw a man who claimed he got stabbed a couple months ago and said that he was internally bleeding, so he needed help. And then I saw a toddler who got hit in the head by a ceiling fan very badly, and he was hunched over and wasn't really responding to anybody. After we stayed in the ER for an hour and a half, we went on rounds. So we just went to different wings of the hospital. We went to the C wing, we went to the A wing, and we would just walk around the floors to make sure everything was okay. Nothing suspicious was going on, so everything was okay. And then in the middle of our round, the security officer I was with got called to a code in the ER. I wasn't allowed to go, but when she came back, she told me that a guy was severely drunk, and he was not listening to any of the nurses or the doctors, and they needed to calm him down, and that was the code. And that pretty much sums up my day as security. For advancements in the security department, all of the security officers use radio communication. They also use video surveillance, and they can look back at things that have happened in different departments. All the video surveillance is throughout the entire hospital. They also have pagers on them that when there's a code called, it shows where the code is so that they can go to it. And yeah. Common jobs in the security department include a security officer and a dispatcher. To become a security officer, you must have a high school diploma or something of an equivalent, and you must do an 8-hour training course. And then you have to do another 8-hour pre-assessment training course. Each course costs between about $150 to $300. A dispatcher is responsible for receiving and transmitting important messages and tracking equipment and vehicles and recording other crucial information. To become a dispatcher, you must have a high school diploma or something of an equivalent and complete a training program. For security guards, there's around 38,000 security guards employed within hospitals. Their mean hourly wage is around $17. This is approximately $36,000 each year. For dispatchers, there's around 98,000 currently. They make approximately $19 to $20 an hour, which is around $40,000 a year. And the job outlook over the next 10 years for both professions is expected to grow around 6%. So for my connections to this rotation, for my world connection, all around the world, airports, hospitals, concerts, malls, stadiums, all of these places require security, and it's what keeps the place safe and functioning smoothly. Without a security department, there'd be an increase in crime and lack of adherence to the rules. My personal experience interacting with security departments is mostly within airports. There's a lot of security that goes into that. My text connection to my security rotation would be a book called The Art of Intrusion by Kevin Mitnick. I read it a while ago, and it includes real stories about different hackers and intruders, what like their plans were, and so it's really the other side of what security is trying to fight against. So I thought it was pretty interesting. To further my knowledge of security, I will be reading and looking into the book Hospital and Healthcare Security by Tony W. York and Don McAllister. Overall, I enjoyed my time at the security rotation. I saw things that I've never seen before. For example, I saw a dead body for the first time. Can't say I loved the experience, but it was definitely different from other rotations. I also did get to see the rooftop of Ellis Hospital, which was a nice view. I always felt like we were doing something and we were always busy, and I really enjoyed it. And there's never a dull moment, which I thought was interesting, and I really respect what the security guards are doing at the hospital, especially Ellis Hospital, where they're surrounded by a community that maybe has like a higher crime rate than other places. So keeping the hospital safe is very crucial to the operation. Personally, I would not really consider myself a good person to be working in the security field. It's just not really my skill set, I guess, but I do respect the work that they do, and I enjoyed my rotation. The Family Medicine Department is located at the Cushing Center of Ellis Medicine's McClellan Street campus in Schenectady, New York. The department's purpose is to provide sick visits, physicals, and primary care to patients of all ages. The staff is primarily composed of nurses and physicians. The nurses are the ones who take the patient into the room, check their vital signs, ask them about their medical history, what's been going on, and then the physicians are the ones who can prescribe medication, can figure out what's wrong with the patient, can send them to or refer them to different doctors for different care. The Family Medicine Department interacts with multiple departments within the hospital, including the engineering department. When something in their department isn't running correctly, they'll call the engineering department, the lab to send test results to, and the pharmacy, so that when they prescribe a drug for a certain patient, then the pharmacy will get that and make up their prescription. I only had one day at the family medicine rotation. When I got there, I was greeted by a couple nurses. They told me that the doctor I was paired with was with a patient, so I waited around for around 30 to 45 minutes, and then we got right into visiting patients. Our first patient that we saw was a middle-aged woman. She was complaining of numbness on this side of her head. She had a feeling of water running down her face, which might have been a nasal issue. She also had a lot of body cramps. So the doctor referred her to a cardiologist to see if, just to make sure that everything was going okay with her heart. She was going to have an EKG done, and if that was all good, she was going to do a stress test. So that was the first patient we saw. Second patient was around an 11-month-old, and she was just there for a checkup. The visit was not long at all. It was about 5-ish minutes. They asked the mother how she's been doing. She recently did have a vaginal infection, so they asked her how that was going. She said it all cleared up. And then she took a look at the child. The child was very healthy, very happy, and so that was the extent of the visit. So then we went on to our next patient. Our next patient was an older woman, around maybe 56, I would say. And she came in just for a checkup, but she was complaining that her blood pressure was always high, and when she was home alone, she would get bad anxiety, which would cause chest pain. So the doctor referred her to get some anxiety medication, and she also put her on a regular daily dose for her blood pressure to help lower that, because when the patient came in and the nurse took her blood pressure, it was pretty high, and she said that she had a cuff at home that would take her blood pressure usually, and that was also, it would often read that it was very high. So she ordered blood pressure medication and anxiety medication, and they set up an appointment in a couple weeks to come back to see how she was doing. And those were the 3 patients I got to see, and then my visit was over. Some advancements in the family medicine department include all the medical documents are no longer kept in piles of paperwork. Records are now all online, so they're more easily accessible and they're more organized. Another advancement is the use of cell phones that can be used in order to research different medications. One physician in particular had an app that allowed him to look up different medications that could be used for different illnesses, and then it compared different brands and their prices and their statistics to help him decide which medication was the right one for his patient. And this app led to overall efficiency. The nurses in the family medicine department must have a minimum of an associate's degree with the completion of a nursing program. The overall education may take around 2 to 4 years, with continuing medical education throughout the career. Pertaining to CME credits, nurses must complete 30 hours of approved continuing education within the 24 months preceding the expiration of their license. For the physicians who work in the family medicine department, they are required to obtain a bachelor's degree, complete medical school, a residency program, and a fellowship, which is actually optional, and become licensed, and continue their education throughout their career. In total, physicians' education takes around 11 to 13 years. To legally maintain a license, one must participate in continuing medical education requirements. For all physicians, this may include online modules, courses, or tutorials. On average, these physicians must complete an average of 25 hours of continuing medical education during each year. For the nurses working in the family medicine department, their average salary is around $52,000 to $88,000. Within the next 10 years, the job outlook for nurses is expected to increase 9%, meaning there will be a greater demand for nurses in the future. There are nursing jobs as well as physician jobs available in the public sector. This includes jobs in the military. Also for nursing, jobs are available in a jail setting or a school setting. For physicians in the family medicine department, their median salary is around $284,000 a year. The projected 10-year job outlook for this profession is also high, with a 14% projected growth, as a large chunk of the nation's population, the baby boomers, are aging, along with the ongoing proliferation of healthcare services. Within the government, physicians can work for government-run hospitals, the New York Civil Service, the New York City Department of Health and Mental Hygiene, and the United States Public Health Services Commissioned Corps. For my personal connection, every year I have an annual checkup with my primary care, so I have experience on the other side of things, on the patient side. My world connection is that although primary care is a necessity in the United States, a lot of places around the world don't make it necessary. So people only come in when there's urgent cases that they need to be seen, and primary care is essential for getting people vaccinations, doing regular blood work, and just physicals. So primary care can improve overall quality of life by addressing more minor medical issues that normally come up in a annual checkup. This is why primary care is a necessity in improving quality of life and should be a necessary part of healthcare all around the world. An article I read recently through my research in my New Visions class is the importance of a primary care provider. It discusses the importance of the primary care providers in screening for all major health-related conditions, whether the patient is, known to them or not, and just managing all their chronic conditions and just like the little things, and it just overall improves the patient's quality of life. I overall really enjoyed my rotation at the family medicine department. I liked how you got to see a variety of patients, so went from seeing an 11th-month-old to like a 56-year-old, and they all had varying conditions. It wasn't all like the same category of issues. It was all over the board. I kind of figured out that I like working with the younger population through my rotation, and I actually, after this rotation, I would consider a job in the family medicine category of healthcare. And yeah, I just think that it's nice to be able to like interact with your patients and really get to know them, and you get to see them like on an annual basis or more often. And I think it's cool that you get to really form like a bond with your patient, which I thought was nice, which the doctor who I was with actually talked to me about. That's why she likes family medicine, because you get to form bonds with your patients. So overall, I really enjoyed my time there, and I would consider a profession in family medicine.